Doctors In live on the interwebs with TOA. I'm your host, Dr. Gray Stallman. I'm an orthopedic spine surgeon here with TOA. I've been practicing now almost 25 years. Hard to believe. We put together these video presentations to give you more information, to kind of connect with you and hope to personalize a little bit what we do so that what is going on with you is not so scary. I want to remind everybody, particularly those people who haven't been with us before, that yes, I'm an orthopedic surgeon, but I am not your orthopedic surgeon. Today, this information we're going to talk about should be considered for educational and informational purposes only. If you have a medical problem, if you have a musculoskeletal problem, a spine problem, why don't you give us a call or go on to www.toa.com and make an appointment with one of our folks. We can do a lot to try to help make your lifestyle better. So it's the new year. We've been doing these videos now for a little bit, and I hope they've been helpful to y'all. I think that we've gotten better at them. We certainly have better equipment thanks to our team here. And definitely I am open to any suggestions, comments, criticisms. We want to make this helpful and useful for you. Yeah, I'm a spine surgeon. So what we started doing was talking about spine care. But I figured people are going to get tired of talking about spines. And so for the new year, we're going to start some new programs which include dialogues with other physicians at TOA to talk about things in their specialties, so shoulders and regenerative medicine and foot and ankle and things like that. So coming up in the next few months, we're going to start having guests, and those guests will be some of my colleagues, and we're going to have a conversation about a variety of topics. So if you all have interest in talking about anything orthopedic, let us know. And we'll try to get the right folks on, talk about stuff that's important to everybody, okay? But in the spirit of spine, because it's still the first of the year, I thought I'd talk about a little bit more of a different viewpoint than what I traditionally deal with. Okay, so I'm a medical doctor, I'm a surgeon. I work in the realm of what is known as allopathic medicine or Western medicine, traditional medicine. So I go to medical school and all that kind of stuff. In the care, particularly of the spine, there are alternative care pathways that a lot of people use. I call these I've totally blanked on what I call them. Collaborative care or complementary care to Western medicine. So these really come down to the chiropractic world, the natural healing or treatment world, perhaps the osteopathic world, and we're going to talk about some of these things as it relates to back pain, spine care, and helping people live their best life. So to start, we'll go with chiropractic first, because most people have heard of chiropractor. Many of you have probably been to a chiropractor. First off, I want to let you know these are my opinions, okay? There's a lot of information out there and a lot of differing opinions with regard to particularly the world of chiropractic. There are many allopathic physicians who completely believe that chiropractic philosophy and care is bogus. In fact, in the 1960s, up to the 1980s, the American Medical Association tried very hard to get chiropractic wiped off the map, okay? I'm not so dogmatic about chiropractic, and I'll tell you why in a minute. So basically, chiropractic is based on the theory that the spine has a lot to do with how we feel, and that there are some forms of malalignments or altered positions or changes within the spine that, if they can be manipulated, can help improve health. The start of chiropractic is rather interesting. The story's a little bit different. There's a couple of variations, but essentially, Daniel David Palmer in the late 1800s, who developed chiropractic and developed the first chiropractic school, started promoting chiropractic. Now, there's a little bit differences in the stories, but started promoting chiropractic with his experience with a particular janitor in his building, as I believe. This janitor had some partial hearing loss. It had been going on for a long time. Mr. Palmer observed that this person had some form of either spine alignment problem or a mass on his back or something like that. This is where the stories vary. And either he pushed on it or he hit it, slapped it, something like that. And the janitor person said his hearing got better. This is where it started. Well, as you can kind of understand, that's kind of sounding a little voodoo-ish, okay? I can totally get where standard medical doctors are pretty suspect of that line of treatment. Anyway, chiropractic developed from that initial experience. Interestingly, Palmer was also somebody who was promoting magnets as part of therapy for general health. That's, again, a very controversial topic. But it evolved over years and years and years. Chiropractic today, as I understand it, and you've got to understand that chiropractors go to school, they learn about anatomy, they learn about physiology, they learn about pictures and x-rays, but they learn about things in a different way than I do. So they have a bit of a different language about the body than my training gives me. So there's a little bit of, I don't know what they're talking about because I was never educated the way they were educated. So I always have to be careful when I talk to people about chiropractic to let them know that I'm not a chiropractor, I am not in their head, so I can't tell you exactly what they're thinking. But in simple kind of terms, modern chiropractic essentially looks at the spine as the source of many problems and creating alignment in the spine by manipulating the spine either manually by pushing on the spine or twisting the spine, using various machines or tools to try to change the alignment of the spine. The theory is that they can improve health, they can improve comfort, they can improve function. This is where the difficulty runs. All of this is based on theory. There really is no hard and fast, reproducible scientific data that supports chiropractic's claims. Now, with that said, I think there are some things about chiropractic that the results are actually supported by the literature. But the whys, the how it works, I don't have a good handle on any good information out there about that. So it makes me a little nervous. I'm a scientist. I work with data. I work with tests, studies, reproducible outcomes. When something's not based in data, it's hard for me to understand and wrap my head around it. So I want to tell everybody out here, I'm open to the thought of chiropractic. I do not accept at this point some chiropractic's claims of curing diseases or improving scoliosis or treating cancer with spinal manipulation. I don't have anything that helps me to understand that that makes any sense at all. Where I do find the benefit of chiropractic is actually the therapy side of chiropractic. So basically, simple chiropractic or general chiropractic is manipulation of the joints of the spine, manipulation of the soft tissues around the spine to make things move better and theoretically line up better. I look at it as manual therapy, basically hands-on, pushing joints and tissues further than the patient themselves can push them to try to help relieve discomfort. I think there's a role for that, okay? Most of the time when people have low back pain, for example, the vast majority of people, at least in this community, actually see a chiropractor more commonly than they see somebody like me. A lot of people don't want to come to me because they're afraid I'm going to make them have surgery. So they go to the chiropractor because it's non-invasive, it's simple, it's local. There's a gazillion chiropractors out there in the community. It seems to help them feel better. Now, I would never say that I believe chiropractic cures disease. I would never say that I believe that chiropractic cures spinal degeneration. I would, however, say that chiropractic can have a role in trying to manage away acute low back pain or sciatica symptoms. I think that it can help manage to some degree chronic back pain, simply because the manipulation of the spine helps keep the body be more limber. It may help to bring some blood flow to the tissues that are manipulated, which can then bring anti-inflammatory effect to those areas and help symptoms improve. But it's not something that can structurally change something permanently. I'm open to chiropractic. I'm one of those unusual spine doctors that actually sees a role for chiropractic in simple back pain problems. Now, chiropractic is not without its negatives. Chiropractic can hurt people. There are some people who should not undergo chiropractic, and the chiropractors admit to this as well. Pregnant women probably should not have chiropractic. Why is that? Well, there's a fear of maybe perhaps damaging the child or injuring the mother during these manipulations. People with osteoporosis who have brittle bones shouldn't undergo chiropractic because the manipulations that can go on can potentially break a bone. People with widespread cancer probably shouldn't undergo chiropractic for the same thing. People who have, we're very cautious about chiropractic manipulation around the neck, such as adjustments. And the reason why is in the lower back, the spinal cord isn't there. There's nerves down there, but there's no spinal cord. So if something disastrous happened, you could injure nerves, but you couldn't paralyze somebody. In the neck, if you push too hard and something gives way and you damage the spinal cord, you could be quadriplegic. That's bad. And so we're pretty cautious about aggressive spinal manipulation in the neck. Chiropractic entails a lot of facets of treatment. The mainstay is manual manipulation. Some is massage, some is physical therapy and exercise, some is traction. Occasionally, chiropractors branch out into other fields. More and more recently, chiropractors, a number of years ago, probably 2 decades now, introduced what's called spinal decompression, and we're going to talk about that in a second. That's basically electronically or machine-controlled traction, which is stretching of the back. That's been used forever in physical therapy. It has a role in trying to help make people feel better, but it comes out of the chiropractic world. Again, I don't believe that chiropractors can cure diseases. Some may claim they can help with diabetes or weight loss. Really what they're working on, and in their training, it's more diet management, lifestyle management, weight loss from a nutritional standpoint. It's not the manipulation that's doing that. I do not believe, and there's no data to even support at all, curing diseases like cancer, heart disease, and that type of thing. And I do not believe, and I know for a fact, that chiropractic cannot arrest the progression of pediatric spine curvature called scoliosis. It is not a treatment for scoliosis and should not be advised for kids with scoliosis. That's my viewpoint. Chiropractic on infants, I think, is a disaster waiting to happen. I think there's no benefit there. And in my opinion, it should be outlawed. It's not appropriate in my opinion, okay? So chiropractic is essentially a hands-on therapy for the spine. Why do people like chiropractic? Well, again, it's local, it's relatively affordable, although most insurances don't pay for extended chiropractic. Some insurances actually do pay for chiropractic care. It's hands-on. People like being touched. People like to feel like their caregiver actually cares. And when somebody's pushing on you, whether it's massage therapy or whether it's chiropractic, that appeals to people. They like it. And so people will do that. And then lastly, because they're afraid of what I may recommend, which is either medication or surgery in the extremes, they're trying to avoid coming to see me. So we see a lot of chiropractors working with folks. I think a majority of chiropractors are genuinely interested in trying to help keep people comfortable and functional. I think there are a few charlatans out there, just like there are a few charlatans in the allopathic world. I mean, I certainly don't believe in any doctor who basically writes prescriptions for pain medicine for a favor, either money or sex or something else. That's as bad as anything, okay? So, but the majority of chiropractors out there do have a role in my world. I will tell you that I've not trained as a chiropractor, but I trained with a chiropractor during my training as a spine fellow, and it was very interesting. I think chiropractic is used a lot in professional sports. Why is that? It's one more modality to try to get people back on the field or in the game without downtime. So, as I mentioned, spinal decompression is kind of the next thing we're going to talk about. That's actually an offshoot of chiropractic that's blended with physical therapy principles. And basically it's traction. It actually can be very helpful. Traction is the stretching of the spine, usually the lower back. As we've talked about in some of our other episodes, gravity is not our friend. Sedentary lifestyle, sitting on our rear ends, is not our friend when it comes to comfort in your lower back. If we can turn everybody upside down and take away some of the forces of gravity, make them longer, many people feel better, and that's where the spinal decompression comes in. Spinal decompression theoretically can also help reduce some of the nerve compression by, and this is a theory, this has never been proven, a theory that maybe perhaps the bulging discs that are there that are putting pressure on the nerves somehow kind of shrink back into the space where they came from and put less pressure on the nerves. I do know that spinal decompression can be helpful symptomatically. Whether it's truly a curative treatment, I don't believe it is. I think it's a management tool. The trouble with spinal decompression is it's typically costly. Spinal decompression treatments can cost anywhere from $20 to $200 a treatment. And most chiropractors doing spinal decompression, depending on the area of the country, will recommend 10, 20, 40 treatments. So you can see you can get up to $5,000, $6,000 for a series of treatments. The trouble is it's not a curative process in some patients. Some people can make them symptomatically better. It's not fixing the cause of their problem, but maybe the cause is not fixable. So it really depends on how much money you've got and what you're willing to go through. Some people find value in the spinal decompression. I've personally sent people to chiropractors for spinal decompression. A lot of people don't find long-term benefit. A few patients I've seen have had spinal decompression and have regretted it because it was so costly and it didn't fix their problem. But it definitely is a tool that can be used to try to help people manage low back pain, nerve pain related to disc herniations, nerve pain related to spinal stenosis. It's a legitimate treatment modality, okay? It comes out of the physical therapy world, frankly. It's just modified and fancied up some. There are some other modalities in chiropractic that are much more controversial. And I can't remember the term that's used, activation is what it's called. where they use a little device that's basically a spring-loaded plunger that kind of taps on the spine in a much more gentle way. I've held those devices. I've used them on myself. They don't provide any real force to anything, so I'm not sure what they do. Some people say that they help. It seems kind of a little bit flaky to me. Lasers, cold laser therapy is a tool that some people in the chiropractic world and some people in the physical therapy world use to try to help make soft tissues feel better. Again, not really any data to suggest that to support the theory behind it. There is some data out there to suggest that maybe it can be a tool to help manage symptoms. And in fact, the data that we're talking about with regard to chiropractic suggests that chiropractic is about equal to other non-surgical treatments that come out of my world, medication, physical therapy, activity modifications, and education, as far as managing chronic low back pain. So I think there's a role. It's a little bit what you feel comfortable with. Some people have no interest in chiropractors because they feel like it's completely a voodoo profession. I get it. I'm a little bit more open-minded, okay? So that's kind of the chiropractic side of things. Osteopaths are physicians who train in a similar type of manner. There's a lot of manual therapy in the osteopathic world. You know you're seeing an osteopath if they have DO behind their name rather than MD, Doctor of Osteopathic Medicine. But osteopaths have a far more rigorous credentialing process, very much like the MD. So osteopaths, DOs, and MDs, for the most part, can practice in any field of medicine, depending on their postgraduate training. They can prescribe medications. Chiropractors cannot prescribe medications. Chiropractors should not and cannot do joint injections, for example. That's an invasive procedure that's not part of their allowed modalities, at least in this state. But osteopaths also have a lot to do with natural, more homeopathic types of treatments, such as nutrition. They probably have much better education about nutrition than I ever got. But DOs and MDs are very complementary to one another in that regard, as far as capabilities and skills and expectations with regard to minimum amount of training and whatnot. The last thing we're going to talk about is some of the other stuff that's out there, and really the one that's kind of the most interesting to me is acupuncture. Acupuncture actually comes out of Eastern or Asian medicine. It's a philosophical modality of treatment of health that I have no experience with regard to education. Eastern medicine has a completely very long history that's different than what I know. Even the theories behind it are completely foreign to people who were trained the way I was trained. With that said, so acupuncture is, in simple, placing needles into the body in certain specific locations that alter the electrical flow more than anything into the body that can affect the health of other areas of the body. In my world, most of the time, acupuncture is used for pain management. In the sports world, it's used for pain management. In the general complementary medicine world, some acupuncturists will work with general health diseases and that type of thing. I have no information about that whatsoever. Acupuncture can be helpful in some people. Why is that? I have no idea. I'm not sure anybody can tell you why, but it seems to help some people. Whether it's a chemical response, whether it's an electrical response, is there a placebo response where it's the mind taking over? I don't know. The practitioners would say that there's alterations in the chemistry and the electrical system of the body that they're manipulating. There may be something to that. I'm certainly open to it. It's minimally invasive. It's generally safe as far as I can tell. And it may be effective for some people. I mean, it's certainly been around a long time, you know, a heck of a lot longer than my branch of medicine. I mean, it's been around for thousands of years. So it's something that I've had a little bit of experience with patients. There are a few acupuncturists here in town in Nashville that have a pretty good reputation, and I've seen some of their patients, and it can help people feel better in some cases. Again, I'm not an expert in acupuncture. I'm not an expert in who would benefit from acupuncture. I'm not opposed to it as far as a piece of the puzzle that we use to try to help people feel better. I mean, frankly, what I do for a living, I can't fix everything. Nobody can. Body parts wear out. Body parts deteriorate. Our bodies get worse as time goes on. Most of what I do, as far as pain management and whatnot, is trying to temper, trying to make the effects of Father Time less, to help people be more functional. And I use exercise, therapy, medications. I've used chiropractic. I've tried acupuncture. And I can do surgery on certain things to try to help improve things. I'm not saying that my branch of medicine, allopathic medicine, is right and everybody else is wrong. I think that would be short-sighted. I, however, am a scientist, and so my core belief is that I want to see the data. I want to see proof that it actually is effective. Frankly, in my world, in the spine surgery world, we do a lot of things that don't have solid data. We think it helps, but we don't have studies that absolutely prove it helps. And that's a problem too. That's why some people don't get better with spine surgery. But I'm not opposed to trying anything that I think is at least safe for people in order to try to manage their symptoms better. Because when you're stuck with there's nothing left to do, in my world, that's pretty depressing and it weighs on people. And so if there are other alternatives that may have some opportunity to help, I'm definitely open to it. So anyway, that's kind of my little short rant, if you will, on complementary medicine in the spine world, in my world. I know there's lots of other complementary types of techniques out there. Massage therapy, we use some mind-body meditation and things like that. Controlling your body using control of your mind actually can be very effective. Psychological counseling can be helpful in helping people to manage some of their chronic pain problems. I think all of these are complementary to one another. I don't think one replaces another. I think they all are, at least in part, all have a role in potentially helping people. Some things work for one person, may not work for another, but at least we have some options. Why do we have so many options? Because there's not one thing that helps everything. That's the problem. That's why you see the back is such a complicated structure. Look at our other videos. We've talked about anatomy. We've talked about various processes related to aging and lifestyle choice and whatnot. But it is a common, complicated problem that has no fix. We can't turn off the changes of aging related to your spine, and therefore we will always have people with back pain problems to some degree. But because there's no one particular thing that fixes everything, that's why you see all kinds of these other modalities out there. In my philosophy, I think they all have some part of a role, some more than others, depending on the situation. I do think that movement, staying active, staying mobile, avoiding a sedentary lifestyle, keeping up with your stretching and strengthening. Go back to some of our videos. I've got some stretching and strengthening videos that I've put on YouTube that we'll refer back to, that you can look at to try to help manage things. Again, these are maintenance tools. They're not cures. They're management strategies. And I think there's a lot of things that can go on to help you live a better life. So, in closing, thanks for joining us today. I hope this has been somewhat helpful. If I've rubbed you the wrong way, I'm sorry. I call it like I see it. Again, I'm open. I'd love to hear your comments. If you'd like to get more information from us, why don't you go to www.toa.com. That's World Wide Web for you millennials who don't know what www means. I was there when it started. You can get information about your body. You can get information about our practices, about our physicians, and find somebody who can help you improve your function and your lifestyle. Again, next time we're going to talk about, the topic is called My Arm is Numb and It Hurts, Am I Having a Heart Attack? It's really talking about pinched nerves in the neck. It's very similar to the disc herniation in the lower back talk we had a few episodes ago. So we're going to start talking a little bit about the neck, a little bit different things there. So that'll be our next episode next Friday at noon. Be there. I look forward to seeing you. Until then, look forward to our branching out into our guest appearances. That'll be coming up in February and March, I believe. Look on the website, the Facebook page. We have some adverts about that will be coming up. And then until then, go out there and live your best life.